Welcome to the Day 2 of American Thoracic Society, ATS, 2024 Conference Update. Here we present the latest research on various pulmonary conditions, including COPD and asthma. Comparative burden of disease associated with short-acting beta-2 agonist and systemic corticosteroid exposures in U.S. children, adolescents, and adults with asthma. Miguel Jose Lance presented a study that compared the use of short-acting beta agonists, SABA, and the exposure to corticosteroids, both systemic corticosteroids, SCS, and inhaled corticosteroids, ICS, among children, adolescents, and adult patients. It was found that children with asthma received higher doses of systemic corticosteroids, SCS, and had lower inhaled corticosteroid, ICS, exposure compared to adolescents and adults, with increased SABA use leading to higher SCS use across all age groups. Longitudinal clinical course of participants with asthma in Severe Asthma Research Program, SARP, cohort. Haru Sumino from Washington University revealed results from a long-term study on asthma using SARP3 and SARP4 data, following 242 patients over 7.8 years. The study found decreased asthma exacerbations and healthcare use, but only a small portion achieved remission, mainly those healthier at baseline. Implementing the Asthma Impairment and Risk Questionnaire, AIRQ, and Asthma Checklist in Primary and Specialty Care Practices, Effects on Exacerbation Occurrence. David A. Bueters presented his work, which highlights the importance of asthma monitoring tools in asthma management. By implementing the Asthma Impairment and Risk Questionnaire, AIRQ, and Asthma Checklist, it was observed that there was a decrease in asthma exacerbations in both primary care, PC, and specialty care, SC, settings. These findings suggest that using these tools can help reduce exacerbation occurrence in asthma patients. A multicenter study on deriving and validating data-driven phenotypes for sepsis-induced acute respiratory failure in ICU patients. Till Andrew Chowdhury reported that by using machine learning, 4 distinct phenotypes of sepsis-induced acute respiratory failure, multi-organ dysfunction, severe hypoxemic respiratory failure resembling a RDS, mild hypoxemia without other organ dysfunction, and multi-organ dysfunction with suspected hepatic injury, coagulopathy, and lactic acidosis were identified. Despite similar baseline characteristics, these phenotypes displayed significant outcome differences, with mortality rates ranging from 21% to 51%. Effect of smoking cessation on COPD exacerbations, spirometry, and respiratory symptoms in spiromics. Laura Glassman from the University of California presented her data from a large cohort of smokers with COPD to understand the effects of smoking cessation on exacerbations. She said that quitting smoking reduced exacerbations in COPD patients, with no similar benefit in active or former smokers. Quitting also improved BMI and COPD assessment scores, underscoring the importance of cessation in COPD management. Relationships between bronchodilator responsiveness, a COPD polygenic risk score, and COPD progression. Spirit in 40s presented the findings on the association between bronchodilator responsiveness, BDR, and a polygenic risk score, PRS, for COPD in smokers with normal spirometry. He reported that both BDR and the COPD PRS were linked to COPD progression and lung function decline at follow-up visits, indicating a potential complementarity between BDR and genetic risk in predicting COPD development in this population.